We will begin. Hello, thank you so much for joining us tonight. My name is Abby Ingber, and I'm the Executive Director of the National Education Alliance for Borderline Personality Disorder. I am joined tonight by Tina Moore, who is our Manager of Family Connections, and Susan Davidson, who is one of our esteemed Family Connections leaders who teaches a lot of our weekend classes, helps us mentor leaders, and works with us on some great programs and activities. The National Education Alliance for Borderline Personality Disorder is a nonprofit organization that helps family members dealing with loved ones who have borderline personality disorder. We do this through advocacy, awareness, outreach, research, and education. Family Connections is our worldwide known program. Family Connections is a 12-week course where we teach psychoeducation, skills, and support. It is offered throughout the United States in-person classes, through Zoom, and through conference calls, and we are also in about 28 countries throughout the world. It's my pleasure to introduce Susan Davidson, who will be joining us today and teaching us a little bit about self-validation and observing limits. Susan, the floor is all yours.
Thank you, Abby. I'm a little bit intimidated doing an online virtual class with over 200 people. Most of my classes are interactive or they're on site. Yet here we are in this age of social distancing, quarantine, isolation. And I think these webinars, first of all, are just fabulous that Tina and Abby have been sponsoring for family members, both experienced graduates of our Family Connections classes and people who have not yet taken the class. We recognize that everybody who comes to our class are family members, usually in some state of stress or distress or anxiety or chaos. And so, you know, we take that to start with, and then we throw on a pandemic. And so we didn't think that was enough for you to have a relative who suffers from BPD, borderline personality disorder, or emotional dysregulation. And with the pandemic, we started a class because family members desperately needed one. I'm in the middle of one with another leader. She's out of New York City. And I told them when we started the class, I was going to rename the class Survivor, the Home Edition, because that's where I kind of feel we are right now. What I love about what we're going to cover tonight is that we are often in our Family Connections classes focused on our relatives, our loved ones who are suffering terribly, and the chaos that's caused, the pain that everybody shares. And we talk a lot, as Marie Paul's going to do on Monday's webinar, talk about validating them, dropping judgments, staying calm, trying to keep the relationship balance. What we get to talk about tonight, which is great, is us. So I have the honor of covering self-validation, which is about taking care of ourselves, and observing limits, which is also about taking care of ourselves. Both of these skills that are DBT skills, dialectical behavior therapy skills, that we teach in Family Connections are really for the purpose of helping us stay in the game, so to speak, with our loved ones and not burn out. Now, those of you who've taken a Family Connections class know that most of the leaders, and we're all volunteer family member leaders who have a loved one who suffers from a similar mental disorder, that we start our classes with a mindfulness exercise. And so to kind of get us in the spirit of self-validation, soothing ourselves, and a concept that we talk to family members about called healthy selfishness, which is simply taking care of ourselves, especially at trying times like this. I thought we would start with just one mindfulness exercise. And most of our classes, for those of you who've been through our classes, know that we start with a mindfulness exercise. Very quickly, mindfulness is something that gets us centered. It gets us focused on one thing. It helps reduce our stress. It helps calm us and get us fully present. So this is a quick one that we had in our class last night. And what I'd like you all to do, even though I can't see all 200 of you, I want to spend 1 minute, and I want you to close your eyes for a second. You may be in your closet or sitting on the toilet in the bathroom where you have some privacy, hopefully. And closets have sort of taken on new meaning these days. And I want you to close your eyes, and I want you to think about a happy place. And what I mean about that, I want you to transport yourself visually and emotionally to a place that you absolutely love and that you feel at peace. And that can be a beach, That can be somewhere in the mountains. It can be your second home. It can be a farm. It can be the botanical gardens or a park nearby. It can be your den or your library, some place that you love to go. And I want you to mentally and visually transport yourself there. And I want you to take a minute to just experience that happy place. And I'll time it for a minute because we do have 1 minute that we can do this. And use all your senses. See what you see around you. Observe what you see around you. Listen to the sounds. They may be birds. They may be leaves rustling. Smell the smells that you typically smell there. If it's at the beach, you may be smelling the salt water. And feel the feeling of what you feel when you're there. And if there's a possibility, use your fifth sense of tasting, that's fine too. I want you to experience it fully and wholly, which is what mindfulness is all about. So this is sort of a mindfulness meditation exercise. So take yourself to that happy place, and I'll ring a bell after 1 minute. I'll see you soon. Okay. Normally I'd ask for some feedback and what it felt like. I don't have that opportunity in this webinar. I hope, though, it sort of centered you and made you fully present and got all the chaos and the noise that is typically a part of our lives these days, or some of the stress that maybe some of us are feeling being in a lot of isolation with or without other people. So that's a typical mindfulness exercise that we use in our classes. And it's a wonderful way that when the stress starts and as we continue to be isolated in these difficult times, when you feel that, you know, the blood pressure is rising, take yourself to that happy place, hide yourself in the closet or in the bathroom, lock the door, wherever that place is, because we can't get very far from our homesteads anymore, and breathe, because that will help regulate you and calm you. It's known to work in almost every occasion. Just breathe deeply and go to your happy place. So with that, I'm going to start talking about a concept that we call self-validation. And self-validation is really one of the keys that we have for ourselves to help us and help our loved ones manage our emotions. Oftentimes, there is nobody who beats us up better than ourselves, and we spend half of our lives in judging ourselves, and I should have, I could have, I would have done that. In Family Connections, we actually teach you to just get rid of that language. Get those should haves and could haves and would haves out of your language and start dealing with yourself in a realistic manner that is a self-soothing manner. And what we do by self-soothing is it lessens our own distress. God only knows we've got enough stress in our lives as it is. And again, with the social distancing and the pandemic that we're all enduring, it only adds to that stress. So this is particularly timely. Often we are invalidating ourselves. We feel guilty. We feel ashamed of what we do. And of course, that's not to say that others don't help us, that those well-intended mother-in-laws and best friends who are telling us, well, you should have used tough love on them, or I wouldn't have given them money if that were me. You know, judging us. We're guilty. We feel shamed. It's just not healthy for us. To validate ourselves, first, we need to know what we're feeling. And this is an interesting concept. Earlier in the Family Connections class, and we're not teaching it now, we teach a concept, and for those of you who've taken it, this will be a refresher for you. It's called primary and secondary emotions. being able to accurately identify what our feelings are is really crucial to being able to manage those feelings. So we talk about a primary emotion as an authentic, genuine, immediate emotion that occurs when something happens. A primary emotion would be if somebody we love dies, we all feel sadness. We feel grief. That's universal. It doesn't matter whether you live in New York, Los Angeles, Atlanta, or New Zealand. It's a universal emotion that we all hold dear, grief and sadness when somebody dies. If somebody points a gun at us, the universal primary emotion we feel is fear. And that's universal wherever we are, whoever we are, whatever our age or whatever our city or culture or country is. The problem we run into is that primary emotion often quickly devolves into what we call a secondary emotion. And many times that becomes anger. And boy, have I experienced this a lot. My borderline relative is a niece, actually, so I'm a little bit unusual. I'm the aunt of a niece, my sister's daughter, who lived with me for quite some time when she was younger. And sadly, my sister died of cancer about 6 years ago, yet she was with me because we had more resources for her in a big city like Atlanta rather than the cute little city town that my sister and her husband lived in. So anger was sort of my go-to place, and it wasn't serving me very well. And I had to learn to figure out what is behind all this anger. And we find more often than not that sometimes it's disappointment, sometimes it's fear, it's concern. Anger can sometimes help us vent, but it's almost always toxic to our relationships. So we try to get out of that secondary emotion. Guilt can be a secondary emotion. We feel guilty because basically we're sad because we failed at something. So we give an example. I'm angry because she's irresponsible and won't go to her therapist, versus the real primary emotion, which is disappointment. I'm really disappointed that she won't see her therapist. So anger is that secondary emotion, and disappointment is actually the primary, more authentic emotion to the event. And I hope you all understand that. So we've got to be able to quickly label our feelings. And it takes some time to figure out what we really are feeling. I give a great example that happened to me I'm a dog person. I have a foster dog here right now, actually from one of the rescue shelters. I used to have a big old bumbling golden retriever named Baxter, and Baxter was my bad boy. And I remember when he was young, I lived in a house that had a pool in the backyard, and I had the pool cover over it. I went to visit a friend who had a very sick baby in the hospital, and I got back 2 hours later, and lo and behold, I look back at the pool cover, and it's in the bottom of the pool. Well, for those of you who've ever owned a pool, you know when that pool cover goes in and that there is an animal in there, usually it's not good news. It's the animal struggling to get out, and they get tangled in, and they drown. And so I was in a panic. My heart was in my mouth. I'm running around the pool saying, Baxter, Baxter, and I can't find him. I don't see him at the bottom of the pool. And I look down at the shallow end of the pool, and there he is. Somehow I don't know how long he'd been there. He had his two old big paws, big old 85-pound golden retriever, two big paws in that skimmer. It's a square little skimmer in the side of the pool, and he was holding himself up. I have no idea of how he made it there. So I take all that wet dog hair, 85 wet pounds of it, and I haul him with superhuman strength out of that pool, and I give him a big hug, and then I hit him. So that was a primary and a secondary emotion in a nanosecond. And I didn't know it at the time because I hadn't taken the family connections class yet. Yet what I felt for that animal was fear, relief, and love. And I hit him because it devolved. How could you do that? It devolved into anger. So that was my classic example of a primary emotion quickly devolving into a secondary. So if I had stuck with my primary emotion and knew what I was feeling, which was fear and then relief, that would have served me much better and have soothed me much better. So it takes practice to recognize what we're really feeling in a situation like that. What we don't want to do is discount our feelings at all. And a lot of us, again, who tend to be those pleaser types. I have a sister who's a pleaser type. She wants to do everything for everybody. Oh, well, that wasn't that important to me. Oh, it didn't matter that you didn't remember my birthday. We don't discount those. Those are true, genuine feelings that we all have a right to feel the feelings. So to recognize self-invalidation, it's not knowing what we are feeling. Some of you, and this has happened to me, sometimes have you ever just been so angry and there's tears coming out of your eyes and you're crying while you're angry? Well, let's face it, crying is not usually associated with anger. So there's something going on behind that anger. And we've got to figure out what that is. Is it fear? Is it depression? Is it sadness? Is it a concern? We've got to be able to label those feelings. And oftentimes, some of us get stuck in our secondary emotions. We are constantly resentful. We are constantly angry. And if we are experiencing that constant anger and with our loved ones, boy, they will push us to the limit and they give us every reason to experience constant anger. We've got to find out what's behind that anger. And we've got to ask ourselves, what is triggering this anger? What is triggering this tight chest that I feel, or this lump in my throat? Or for me, it's a tight stomach. What is happening here? And that's not always easy to do. What we ask you to do, because we teach the first skill in our class is mindfulness, is be mindful of what you're feeling and really work hard to identify that primary emotion. What is really going on here? Also, if we ignore our feelings, when we know what we feel, that doesn't do us any good either, because we're just going to bury that and it's going to come out in some other kind of fashion. And it's the old discounting our feelings. Well, you know, as I said, it doesn't matter what I think. It's what everybody else thinks. It does matter because it affects us emotionally and it affects our health. When we are self-invalidating, we're allowing people to treat us disrespectfully. Now, let's face it, those of us who deal with a relative, a loved one who suffers from BPD, borderline, or emotional dysregulation, we have gotten more disrespect than we ever thought we could tolerate. And yet we have to get to a point where we can manage that and not just become, as somebody once said, a doormat for our relative. You know, our pain is legitimate and they are experiencing incredible pain. And we talk a lot about that before we even cover self-invalidation and about validating their pain. And yet our pain is legitimate too. And I've always said when people says, well, I shouldn't be so sad, you know, he lost a relative from the coronavirus, let's say, you know, which is horrible pain. It's a legitimate pain. And I only have a relative who suffers from mental illness. Well, I'll tell you, somebody else can die and I still have a paper cut and my paper cut still hurts. It's a different kind of pain and yet it's a legitimate pain. And the other thing, which we're going to talk about next, is we are self-invalidating when we don't observe our own limits. You notice I'm not saying we don't set boundaries or draw that line in the sand. And there's a difference between observing limits and setting boundaries, which I'll discuss when we talk about observing limits. So some of the consequences of that are bad. It reduces our ability to cope, and DBT, dialectical behavior therapy skills, are all about building coping skills. Well, guess what? When we have relatives who are dysregulated and they don't have coping skills, we start losing some of ours. And so if we can build those up in a given situation, it helps us. If we keep invalidating our feelings and what's going on with us, then we start losing our ability to cope. And it can contribute, and many of us suffer from this. Let's face it, we have depression, we have guilt, we have shame, we have burden. Family Connections actually is intended and does research to try to reduce those feelings. It also decreases our overall sense of well-being. You know, we start building up that resentment and that contempt. I had somebody in my class yesterday who said, I'm trying to be able to detach and let go of this, and yet I can't help the fact that I continually resent the fact that my daughter has dropped out of college and always wants money from me. So those are the things that become toxic, not only to the relationship, but to us as well. And it makes us more emotionally vulnerable. We become much more fragile. Marsha Linehan, who, for those of you who don't know, she was the psychologist who was the founder of dialectical behavior therapy, which has proven to be very successful in treating borderlines and giving them coping skills. She talks about our relatives as being like third-degree burn victims. They have no emotional skin. And so a third-degree burn victim is going to respond very differently to a hug than somebody who skin is not burned, is not covered with burns. Well, guess what? We start losing some of our skin, shedding some of our skin metaphorically, and we become very vulnerable and very, very fragile. And emotional vulnerability is no way to engage in a relationship that is challenging at best. And we've got to, have our game face on. And as we say in Family Connections, put our own oxygen mask on to be able to deal with this kind of relationship so that we can have a more loving, kind, effective relationship. When we get into emotional vulnerability, some of the things that rise up in that are, we call it HALTS. It's an acronym that means when we are hungry, not a time to engage in a relationship. When we are angry, bad time to engage in a relationship or communication. When we're feeling lonely, and some of us are feeling lonely these days. When we're exhausted, we haven't slept that night. When we feel sick, if we have the flu, not a good time to engage in those relationships. I remember at one time, I tried very hard when my niece was living with me to deal with all of her issues and to listen to her well and to validate her and to do the things I was supposed to do. And there was a time when I was really having some eye problems, eye issues, and I wasn't seeing very well. And I couldn't cope. I was emotionally vulnerable. I was on the S, the sick type, and I was also the T, the tired. And I just looked at her and I said, I am so sorry. I can't deal with things today. This isn't about you. It's about me. I am taking a 4-day relationship vacation. And that was one of the ways I started validating myself because I couldn't cope anymore. And she was a little bit shocked and stunned by all that. And yet somehow she respected it. And I didn't talk to her for 4 days. And after 4 days, I said, okay, ready to reengage. Let's see what's going on. I just had to give not her a timeout because she wouldn't take any timeouts from me. I gave myself a timeout. And sometimes that's what it takes to be able to soothe ourselves when things are just getting too tense and too stressful. Some of the self-validation skills. Again, we talk a lot about mindfulness skills, and that's paying attention. We've got to feel what we're feeling and make sure that we're accurately labeling what we're feeling, that it is sadness, it's disappointment, it's despair, it's fear, rather than always the secondary emotion of anger. And we've got to identify those areas where we're most often self-invalidated. For me, I felt at one point, where my niece, when she was living with me, she lived in the basement, and I could feel the resentment building in me. She would never change the sheets to her bed. She could live with those dirty sheets. She would roll them up in a ball. My dog Baxter at the time was down there with her a lot, and all of his dog hair was on her sheets. And she was not a neat housekeeper, to say the least. That's a real understatement. And she's still not a neat housekeeper. So her place was a mess. I didn't care that her place was a mess because it was in the basement. It really bothered me. And I let it get to me. And I kept resenting it. And I finally was able to just let go of it. And I finally said to myself, you know what? Nobody ever died of dirty bed sheets. And so it soothed me. I let go of it. She lived with those bed sheets. So I didn't have to look at it. And when she would go home to visit her family every 3 months or so, I would go down there and change the bed sheets. I didn't do it for her. I did it for me because it made me feel good. It was like having that nice glass of white wine that helps me self-validate too and soothes me some. So changing her bed sheets every 3 months or so helped me a lot. So acknowledge that what your emotions are, that you are feeling resentment, and then deal with that. Is it sadness, anger? For me, it was resentment. And I had to actually, bring that down so that I could start dealing with things better. Using radical acceptance of your thoughts, emotions, and actions. Radical acceptance, by the way, is another really important skill we teach in Family Connections, which is basically accepting what you cannot change. As much as you may bang your head against that wall, and you've done it for 10 years, that wall's still not moving. All you have is a headache and some shards of drywall in your head. That we accept reality for what it is in the moment. Not that it's always going to be that way. Yet when we are always fighting reality and wish they'd go to college, we wish they'd see a therapist, we wish they'd get a job or a better job, and we keep fighting that, that's when we start suffering and we start self-invalidating. And I say in my classes, pain is inevitable. The pain of having a loved one who suffers from such a sad, a terrible disorder as BPD, that is inevitable pain. And yet suffering is optional. We don't have to suffer. We suffer when we fight reality. So if we can accept that, yeah, I am feeling resentment. It may seem silly, clean bed sheets are kind of important to me, and I'm resented. If you can accept that and let those feelings come and go, and you might not like the feelings, yet you can accept that they are there and you let them go, and you don't judge yourself and beat up on yourself. Okay, let me see. This isn't advancing. Okay. Self-validation is also sometimes reconsidering something from somebody else's perspective. Should I really feel guilty about this? I personally don't think guilt is a very helpful feeling. It doesn't seem to help you or them when you're always going around, gnawing on your fingernails. I feel so badly. I should have done this. I could have done that. So we get back to, a lot of us, there was a person in our current class who said, I still can't get over the fact there were so many things that I could have done differently. And we will tell that person, there is nothing you could have done. They didn't want to have this disorder, and we didn't want them to have it. We're all in this together. There is absolutely no blame in here. So set the guilt aside. Everybody did the best they could at the time. And yes, we can do some things differently. We talk a lot about assumptions and the rights of relatives in our class. And that's one of the things we talk about, is that every one of you, all 200 and something of you, whether you've taken this class or never taken a class like this, you're doing the best you can at the time. And you can acquire some skills to do things slower, better, or differently. So support your primary emotions. If you're feeling sad, resentful, okay, feel it and let it go. And get out of those should've, could've, would've. On my niece's Facebook page, I saw once, because she took dialectical behavior therapy classes, and she had a sign that said, "Stop shoulding on me." And so I had that stop sign, stop shoulding on yourself, and don't let other people should on you or should not on you. Get those noises out of your head, because that does you no good, because it's about history, what could have happened and didn't happen. And what we have to do is live in the present and in the moment. And don't try to second guess your feelings. When someone else's behavior or actions contradict, they say, well, that's, you really shouldn't feel, you really shouldn't feel guilty about that, or you really shouldn't feel, don't get depressed about that. If you feel depressed about something, sad about something, that's legitimate, because our relatives, when the pet hamster dies, many of them get so depressed that they can't have difficulty getting over it, when the rest of us just say, hey, get over it. Our feelings are all legitimate, and so are their feelings. So we've got to be able to label those correctly. Okay. Before I get to observing limits, let me go back. Tina, what kind of comments or questions have come up on just the self-validation? Let's get through that one first, and then we'll get into observing limits.
Let me see. There seems to be some questions about, you may have grown up in a home that, was invalidating, and you're used to that.
Yes.
Multi-generations of that. What is the first thing you can do to stop that in yourself?
Well, the first thing is to take a family connections class, because we actually help you stop that. Many of us do grow up in invalidating environments. And when we describe invalidating environments in our class, it's sort of, you kind of said, who the heck didn't grow up in an invalidating environment? I always say invalidating environment is just a matter of degrees. Nobody grew up in a completely validating environment. Somebody shunned us or hurt us or did something to us. What we have to do, it's like they talk about, child abuse and sexual abuse. We've got to stop that cycle. So in Family Connections, we ask you just to take off, see these glasses I have on, take off these old glasses, and I've got another pair here actually, and put on another pair of glasses. Look at things a little differently. Stop the invalidating yourself and realize what causes us to invalidate ourselves or to invalidate our loved ones. And one of the big invalidation, and I don't want to get off on another topic that we cover in the class, judgments is a huge part of this. Our default position is judging. Well, that wasn't a very smart thing to do. That was pretty stupid. You're pretty lazy. Kind of, you know, how reckless can you be? All the judge, which causes us to be shamed. We do that to our relatives, and people do that to us. And if we can just bite our tongues, and we talk about a technique where you just kind of stop and you observe the situation and deal with only the facts rather than the judgments, then we can begin to get over that. These skills that we teach in this class are wonderful to teach and very, very difficult to do. And yet so many of us have become leaders because they have worked. And because there's evidence that they do work, at least for the patients who take DBT. So if you can talk about your history of invalidation, you can talk about you being currently in an invalidating household. That doesn't mean that we have to be that person. And we can't change other people, and we certainly can't change the past. What we can change is ourselves. And I'm 60-something years old. That ain't easy to do, changing ourselves. And yet it's possible if the motivation there, and there's a win in it for us. If we see a benefit, and a lot of us, when we start validating our loved ones and validating ourselves, we start seeing some wins, don't we, Tina?
We do. Okay, yes. I have a quick one. If your relative says something to you that's invalidating, how can you respond? Not in anger. Do you have any magic words?
Well, again, that's another class. That would probably be in Marie Paul's webinar on Monday. When they say something invalidating, basically we don't take the bait. There's a lot of ways to not take the bait. And we teach in our classes validating statements or showing curiosity. Wow, what's behind, or just walking away from the conversation. Sometimes if they are completely dysregulated and yelling and screaming in our face, which many of us have experienced many times, there's no opportunity for them to listen or reason anyway. That form of the brain has pretty much shut down. So we just detach and leave the situation and go, wow. What we don't do, because we find that blaming doesn't work for us. Defending ourselves generally doesn't work. Making excuses doesn't work. Teaching them a lesson doesn't work. So what we do is we do no harm. It's like a doctor. A doctor's Hippocratic oath is to do no harm. Sometimes that in our families, that's a win when we've done no more harm. So if they're saying, and they're, by the way, they're constantly saying invalidating statements towards us. That's nothing unusual. So we learn in Family Connections how to deal with it differently by not taking the bait. And there's ways that we can stop ourselves from doing what we've done in the past. Yet we have to start in baby steps. Does that make sense, I hope?
Yeah.
Okay.
All right, we'll collect some more for you.
Okay, sounds good. Let's go on to another skill that helps us. Basically, these two skills that I'm talking about tonight are about reducing burnout and being able to stay in the game. And this one is called observing your limits. And it's another skill that we teach, and we use that term, observing your limits, in DBT classes, because it helps us feel better about ourselves, maintain our own self-respect, because it's pretty much been damaged. You know, they've beaten up our self-respect a lot, and we've beaten ourselves up with it, by the way, a lot. So it allows us to experience really a more loving and trusting relationship. You notice observing your limits is different than setting boundaries. The reason we don't say setting boundaries in DBT is because setting boundaries, first of all, is kind of a loaded term. It's like I'm the enforcer, and this is rigid and inflexible, and no matter what, you're going to have to come in at midnight. You have a midnight curfew. Or you've ruined my computer. You're never using my computer again. Well, the fact of the matter is observing limits is flexible, because there are times, I mean, even the case with my niece, she used my laptop at one time and she screwed it all up, and I use it for work because I'm self-employed. And so I didn't allow her to use my laptop. Now that she's more mature, she's living on her own, she doesn't live with me anymore, I allow her to use my laptop. So this is not a fast and rigid, this is never going to happen again. So that drawing the line in the sand doesn't generally work well for us. And again, it's kind of loaded term. Circumstances do make a difference. The fact that my niece is more mature and more responsible, I hold my breath sometimes, yet I trust her more. It matters that she's at a different stage in her life right now. Thank goodness, you know, we've gone through a long, long journey here together. And we also, in family connections, when things happen to us, we always assume, one of the assumptions we ask you to make is we assume benign, that they didn't do this to hurt us. They are suffering and they are in pain and their minds are racing. So it's like if you go to a cocktail party and somebody steps on your foot, we can assume, well, they're out to get us. They hate me and I hate them too, so I can go back and step on their foot. Or we can assume benign. It was just an accident. They did not mean to step on our foot. She did not mean to break my computer. It was benign. It just happens. It was what it was. So those are accidents in life. Also, observing limits is the real difference. That the way I describe it, you know, I'm a visual person. It's not about putting limits on them. It's about putting limits on us. What are we able to tolerate, and what can we not tolerate? What is keeping us up at night? What's giving us ulcers? What's making us depressed? What's making us anxious? Those are the things that we are not able to tolerate. I was able to finally tolerate dirty bed sheets. What I was not able to tolerate was my niece, when she was living in my basement, destroying the basement. She had kicked in the headboard. She had punched a hole in the wall. I know many of us are in that hole in the wall club. I ask every class I have, and I'm amazed at how many people are in my club. She had thrown a lamp. And so one of the limits I put, because I couldn't tolerate, she was fine with it because it helped her express herself, her dysregulation. She had to let it out. So I gave her, I bought her on Craigslist a punching bag, and that was my limit. I understand that you need to get angry and you got to let it loose sometimes. However, I can't tolerate you destroying my basement. Excuse me. So the punching bag was my limit. And that's probably a lesser example. When we know our loved ones are having a difficult time, sometimes it's hard to know when to set limits. And again, we asked you to kind of go in baby steps here. There is that fine line. And I'm always fascinated with this fine line between enabling and being supportive to avoid burnout. Now, I'll give you a good example that I thought was the enabling versus supportive. When my niece, after her mother died, my sister died of a rare form of cancer, it was horrible and sad. She lived with her father, who she does not have a good relationship with. And he got her back in college because she had dropped out of college. She couldn't make it through. And then she wanted to get through again. And 7 years later, she finally did get through. And so she was struggling with some of her classes, and she would just go to him and say, Dad, I need X number of dollars, $2,000 or whatever for this semester. She was staying at home in the cottage behind her dad's house and going to a college nearby that she drove to. And he would just write a check. He never asked what her grades were. He never asked what her, what she was responsible for, what it really cost. He never asked for a bill from the college. He just wrote a check, and she just, as my sister said, she just used him as an ATM machine. So his solution to everything was to write a check, and yet he never showed any interest or support for how you doing in that class. Do you like that class? She's very, very creative, as many of your relatives are. Wonderful in poetry, wonderful in English. She's a great writer and a very good artist. She's that new age, very esoteric kind of person. And so then she took a class in psychology. He didn't know anything until one of the psychology professors said to him at a party, he said, she's one of my best students. So that was, to me, enabling. I wouldn't pay for her college. And I pay for a lot of things for her. Supportive is when I show an interest in what she's doing. She's going to be doing it. She lives in Atlanta now, in another place, apart from me now, thank goodness. And she's going to try to have an art showing with this group that she's a member of. And so I'm showing a lot of interest in it. I said, be sure, I want to be invited because I'll bring some friends too if you're okay with that. So that's supportive. And I'm not paying for any of her art material. She has to pay for that herself. So you have to ask yourself, am I being an enabler and just throwing money at them? That's often money is an issue with our relatives. Or am I being supportive of them and showing real interest? Your limits may shift over time, and that's human nature. Again, at one time, I wouldn't allow her to use my laptop. She had to use her own, but hers kept breaking all the time, and she kept breaking her cell phone. That's another thing seems to be common with our loved ones. A lot of broken cell phones or lost cell phones. And now I will allow her, with hesitation, and yet I will allow her to use my laptop if she wants to use it for some reason. Observing your limits. This is what Marshall Linehan, the founder of DBT therapy, says. Having a relative, this is a quote, having a relative with BPD can push you sometimes to do or accept things that you might not normally do. You might allow yourself to be treated in a way that you never thought you would accept. Yeah, we all relate to that. Situations like that are not good for you personally, and they can cause you to burn out. Example, you give more money than you're able to afford. People need to observe their limits. This is different from setting limits. Setting limits is not allowing someone to do something like not giving a child candy before a meal. Observing limits is we put a fence around ourselves. We don't put a little white picket fence around them because they're generally going to break out of it. It's hard to control other adults especially, and that's not very successful or useful to try to control somebody else. We learn again and again, that ain't working for us. So what we do is we put a fence around ourselves, and that picket fence can broaden or it can get tighter depending on where we are. Remember that HALTS, if I'm really feeling sick with the flu, that fence gets really tight around me. If I'm feeling good and energetic, I can broaden that fence a lot and I can tolerate a lot more. So observing limits is about us, what we can tolerate, and that's flexible over time. The reason we need to observe our limits is it helps reduce the burnout, which is what we don't, if we want to have a relationship with our loved ones, we can't do it while we're burned out. And I do know actually Family Connections leaders who burned out with their loved ones and they just cut off the relationship for a while because they had to do a relationship vacation or give themselves a timeout. We don't want to get there. We want to stay in the game because we love these people. It helps preserve the relationship, and observing our limits helps preserve some of our self-respect, much of which has deteriorated over the course of a lot of this interpersonal relationship or conflict. So how do you do it? Well, you identify what you're willing to accept, and you identify what goes beyond your limit and your sense of self-respect. And especially for you parents, I'm an aunt, it's easier for me. Siblings, it's easier. You parents, it is okay to say no. We have something that we ask people to pin on their bulletin boards, the rights of relatives. And one of the things that we say in our rights of relatives in our class is that it is okay to say no. There are ways to say no, yet it's okay. It's not something that is we're always walking on eggshells, yet it's okay to say no. Now, let me give you a big important example of observing your limits. We can observe limits in small ways. Yeah, we can get them to, if changing the bed sheets is an issue with you, wasn't that much of an issue for me. Excuse me. But in the case where my sister and her husband were living in their home in a beautiful art colony called Fairhope, Alabama, and Taylor, my niece, was living with me, she would call them in the middle of the night and she would be screaming and yelling and crying, and I'm going to kill myself. I can't take it anymore. Nobody understands me. Nobody has what I have. I'm suffering. This is it. I'm sorry, you're going to have to get used to the fact I'm going to kill myself. Well, they both worked. And they finally got to the point they planned it. They had to put a strategy together. And my sister said to her on the phone, she said, honey, I know you are suffering. She validated, I know you are suffering and you need to talk and you need to vent. However, your dad and I, we literally cannot sleep at night and we cannot function at our jobs the next day. So from midnight to 6 in the morning, we are not going to answer the phone. And if you feel that you're going to be suicidal, you're going to have to call that suicide hotline. You have that number, or call 911. We can't answer that phone between midnight and 6 in the morning. Not about her, about us. we have to be able to function our jobs, and we're not able to function now because we can't get any sleep. So you can imagine the stakes that were high there. So the nervousness of what the heck's she going to do? So and they stuck with it. The first night, the calls came and came and came, and they didn't answer it. Second night, they continued to come. The third night, fewer, and probably by the end of the week, the calls for the most part stopped. So this was a limit that they established for them, for their own well-being, so that they wouldn't literally burn out. And that's an example of what we mean by observing limits. So you have, everybody's situation is different, and they may be little limits or they may be big gargantuan limits. With one of our family connections leaders, the limit was her daughter came home to live again. She was using drugs, and that was one of the rules of the house. You don't use drugs. And she had to tell her daughter, here's my limit. I understand that you're back to using drugs because you feel so horrible, and it's a wonderful way to escape. However, you know that in our house, we cannot deal with the drug use. So we have two options here. You've got to stop the drugs and go into a program, or there's a women's shelter in our city that I will take you to. Now that's a lot of skin in the game. So those are big observing limits when you literally I cannot live with this. So I encourage all of you to think about, being taken advantage of, going through burnout. What is it that you absolutely can't tolerate that is just keeping you up at night? And put a plan together for yourself to observe those limits and do it in a non-judgmental, factual way. No judgments here. This is about me, my limit, not about you. And I understand, you have to do what you be you and me be me. That's kind of what it looks like. This takes time and practice, and especially at times of crisis, I suggest that you start thinking about your limits. Excuse me, that's not coronavirus, that's my nagging cough. That you do it before the crisis occurs. It's hard to build the airplane while you're flying it. So I would suggest that if there's something that is really dragging you down and you are just raw, and you are just almost at burnout and have no oxygen left in your oxygen mask, think about what you would do to observe that limit and what you need to self-soothe, to stay in the game, and to maintain the relationship and your own self-respect, putting your oxygen mask back on, knowing, by the way, that limit may change someday. It's not about them, it's about us. And I may feel much more energetic and much more with it and together to be able to tolerate more in a month, 2 months, or 3 months. Some of us are getting worn very thin right now, as we all know, in the self-isolation. So we've got to determine, if I need space, my safe space, maybe I do take over the closet. Or I take over the bathroom for an hour and sit on the toilet and drink some wine and read a book. Whatever works for you to self-soothe. So I give an example of a limit. Often there's money problems, and so you may have to give yourself time. If they say, "Hey, I need $20. I need some money for gas," you may have to say, "Well, I've been giving you a lot of money recently for gas," and then that resentment starts creeping up, and the exhaustion, the frustration starts creeping up. And give yourself some time. Say, "I need to think about this," and allow yourself to get regulated so you can get back into conversation with them and tell them that whether you're willing to give them the gas money or not, or whether you're willing to negotiate something else. I'll give you gas money this time and won't give it to you next week, or I'll give you $10 instead of $20, whatever works for you. We, again, talk about validation. Oftentimes it's easier to say no when you validate them, and then say no, and then validate. Or you can problem solve. So oftentimes, you can say, I can understand that you want, for example, let me go back to this. My niece at one time, when she didn't have a dime to her name, she started a GoFundMe page so she could take a trip to India to go to an ashram. She's into yoga a lot, which is good. That's fortunately some of her drug of choice. It's not valid that she wanted to go to India. So she wanted me to help her fund that. And I said, I understand that you want to go to India. You know, I know you love yoga. I know you love that spiritual journey, validation. You know, I'd love to take a spiritual journey similar to that myself. Also validation, the me too. My spiritual journey would probably be to do meditation at a spa resort. It wouldn't be an ashram in India. And yet I get that you want to do that. I understand. However, I'm not willing to fund that because I'm paying for your therapy, and that's where I want to put my focus. And yet, validation again, third validation, I really hope that you're going to be able to take this trip because I know how much it would mean to you, and I think you'd really get a lot of it. I said all of that sincerely, 3 validations and a no. All right. So, or we could problem solve. Maybe we could, there's a meditation center outside of Atlanta, and maybe we could work something out where we co-fund you going to that meditation center for a spiritual weekend journey. You know, that would be a negotiation or problem solving if they're ready for that. Some people, some of our relatives are not ready for that. You can't negotiate and problem solve. Others are more regulated, and we have that opportunity. Just depends on where you are in the continuum. So when all is said and done, the most validating concept of all is the importance of that other person in your life and the importance of the relationship. And while we are trying to stay in that relationship, we have to validate us, and we have to understand our own emotions and needs before we can take care of somebody else. Put your own oxygen mask on first, and then we can put their oxygen mask on also. And that would be my observing my limits and self-validation. Oh, and then I'll move ahead in a couple of these things. I want you to, let me go to the last slide, and then I'll take whatever time we have for questions. I want you to let go of suffering, and I want you to soothe yourself. Do that tonight. Do something kind to yourself. Have a glass of wine, listen to your favorite music, read a good book, whatever, do some exercises, and then practice what we call healthy selfishness, and now go wash your hands. What kind of questions do you have?
Before we get to questions, Susan, that was fantastic. I know you're busy talking and not monitoring the chat and the Q&A, but you're getting rave reviews here. Tina and
I need some validation. You send them to me.
We will.
Because I'm going a little stir crazy here myself, so this feels good.
I just want to remind everybody that we are a nonprofit, and we do succeed based on everyone's donations. All of our programs and Family Connections is free, but we thank you for your continued support, and you can support us on our website. So I have a question here. Is it okay to lie when you're observing your limit? So for instance, if your family member says to you, I need to chat right now, is it okay to lie and say, I have to work late and I can't chat right now?
I'm not sure, and this is just me talking, I'm not the therapist here, by the way, so please understand that I'm speaking as one perspective of a family member who's on the same journey with you. I'm a little farther along the journey than some of you, though. I'm not sure that lying in general is good. Avoiding or distancing can be another alternative. We will often say, there's we use expression in our class, be like Bambi. Sometimes if you can't say nothing nice, don't say nothing at all. Or you can distract. You can, a lot of people say, I have to go to the bathroom. Well, you can go to, it doesn't mean you have to go to the bathroom and do anything. You can go to the bathroom. We did have somebody in one of our classes, she did lie, and it was a funny story because her daughter wanted to constantly keep her on the phone. She lived in another city, and when things started getting heated, she'd say, I'm sorry, honey, I've got to get off. I got to turn off the sprinkler. And so this happened for about several months, and finally the daughter said, Mom, you don't even have a sprinkler, do you? She goes, no, I don't. So that would have been a white lie. It was a way to self-soothe, but it's a way to detach. It's okay, I think, to say, this isn't a good time for me to talk. Let's do this later. That you want to let them know you're going to come back to the game, yet you need to take a time out. It's okay to take a time out thing. Whatever your language or your words are for that, we help you with some of those words in the class. Yet it's okay to take a time out. I'm feeling overwhelmed right now, and I can't talk right now. That's legitimate, and that's authentic.
That's great. So we have another question here. I'm sure Tina's monitoring them also and has a couple. So how do you suggest handling when our adult loved one does not, no matter how many times asked, respect our limits?
Well, you have to be, it seems to me you have to be willing to follow through. Limits are not threats. A lot of times, well, if you don't do this, I'm going to do that. That's a threat, and that's coercion. That doesn't work. And that's not really fair, because you don't want to be coerced or threatened either. Think about how we want to be treated. If it's an important limit that you can't live with, you got to let them know what the consequences are. For example, the other Family Connections leader I told you about, she was well prepared to take her daughter to a women's shelter. Painful, risky, scary, all that. She was prepared to do it. My sister and her husband, when they took their daughter, my niece, to a residential treatment center because she was getting very dangerous. This was years ago. And they basically kidnapped her and took her there. And she said, I don't want to go. They took her when she was sleeping, drove 5 hours to this place in Houston, Texas, and said, you have to either go here or there is a women's shelter nearby. They were not going to take her home. So you have to decide if you're willing to follow through on your limit, and what you're willing to do if they don't respect that limit, if it's an important one. Again, if my niece doesn't make the bed, I can live with that. I can live. I don't like it. They do a lot of things we don't like, yet I can live with that. So you just have to determine what you can or cannot live with. We have family members. We have one in our current class. The daughter is living in her car now because the relationship has gotten so bad in the house. Her limit was, it's just not, things are ramping up here. It's so intense. We're both suffering, and we've got to detox this thing. We've got to de-escalate it. And so the daughter's out living on her own and still calls her mom and talks to her. And yet the woman is using what she calls her wise mind, doing what she feels is the right thing for her, so that she can self-soothe and stay in the game.
I have a question, Susan.
Yes.
So a lot of times people will try to, exercise their right to limits. And some people will describe their loved one as, well, they're just manipulating me.
Right.
Can you speak a little bit to that word of manipulation?
Right. Well, I would suggest you all, and we have people in our class do this. There is a wonderful video. It's older, but it has some great concepts. It's about 43 minutes. It's called, you can find it on YouTube. It's called Back from the Edge. You're very familiar with it, Tina.
Yeah.
And it's a kind of a good primer about borderline personality disorder from the consumer, the patient, the sufferer's perspective, the family member's perspective, and the expert's perspective. Marsha Linehan is in it. She's a younger Marsha Linehan at that time. And she says, oftentimes we think they're manipulating. They don't have the skills to manipulate. When I say manipulation, think Bernie Madoff. He manipulated people to get involved in his Ponzi scheme. They didn't know they were being manipulated. He took advantage of them, and they were happy to give him all their money. That's manipulation. What it is with our relatives is they are trying to get what they want or need and communicating it in the worst possible way. We all know in a heartbeat when they're trying to, quote, manipulate us. I'll clean up the room if you'll give me $100. Well, we call that manipulation. That's just a poor expression of what they want. So we ask you to assume benign. They're not trying to manipulate or hurt us. They're just trying to get what they want or need, and they're in a lot of pain doing it in the worst possible way because they don't know how to communicate accurately.
And just so everyone knows, Tina just put a link to that video on the chat for anybody who would like to view it.
That's a good primer for those of you who haven't taken the class. I think it's a good, don't you think, Tina? It's kind of a good way to get an overview.
Sorry. Yes, absolutely. It's about 48 minutes.
But what else are we doing? It's either that or clean out your oven. Which I refuse to do.
All right. Hey, Susan, have you ever heard of something called an extinction burst? No. It's like when you're trying to exercise, again, your limits, and you're putting a limit on some of your, on a loved one's specific behavior, and they do it more. It's like they're testing. Do you know what I mean?
Oh.
And so I don't know if you're familiar with that. So it's like you want to, change a certain behavior or how you're responding to it, and they do it more, and eventually they call it an extinction burst. It's a burst of that behavior, and if you keep stick to your limits in a calm way, it'll eventually.
That sounds more like drawing that line that said, don't cross this line. Then they cross the line. Well, okay, well then don't cross this line. I'll cross that line.
Got it.
We generally don't subscribe to that because it doesn't work, because they cross the line. And by the way, let's be clear, we're not going to change their behavior. All we can do is manage our emotions and our response to their behaviors. Now, we find in Family Connections, when we start adopting some new behaviors, and family members who've been through our class will tell you this, sometimes we'll see miraculously a change in their behavior because we're dealing with them differently. Yet we can't go in with any expectation. If I do this, I'll twist and contort them, and they will bend to my will. In DBT, they talk about something called willingness and willfulness. And when we start using willfulness, as our relatives often try to do with us, it doesn't work. We don't want anybody. I mean, think about yourself, put yourself in their shoes. Do you want somebody trying to change your behaviors and force you to do something you don't really want to do? No. So why would we expect of them? And they can't even validate or regulate themselves. So you're not going to change their behaviors. All you can do is change your behaviors and your response to their behaviors. That's a difference.
Excellent. Thank you.
So Susan, I know that it's 8:32 and it's been an hour, but we're people are not dropping off. They're loving you.
Yes.
So I'm having fun with this. This is fun.
Can we pose a couple more questions to you?
Sure.
Okay. So we have a question here, and I'm bringing this up because you mentioned that it's your niece, not a daughter or a son, who is the one with BPD or BPD traits. And that's a different type of love and a different kind of love than one would have from for their own daughter, even though I know that you love your niece very, very, very much. We've had a couple of questions about how do you work on a relationship with someone who maybe your mother-in-law who you don't love, or a spouse where there is not that unconditional love, or for you, your niece, who it is that different relationship. Do you have any tips or recommendations for how to handle those types of situations?
That's an interesting one. I think that the skills can be the same, and yet the relationship is so different. As both you, Abby, and Tina know, most of the people who sign up for our classes are parents. And they are in this for the long haul. They're parents who have a son or a daughter, adolescent or adult son or daughter, who's suffering from this terrible disorder. We often, though, from time to time, get spouses. We get siblings. We've got, in a couple of my classes right now, we have an adult daughter who has a mother who she thinks, she hasn't been diagnosed, but thinks suffers from borderline and has dealt with that. That's a very different relationship, and the dynamics are different. I don't have an answer to that, and yet I can tell you, I remember one workshop I did last year in Philadelphia. It was really fascinating. We had an entire table of, what were they, adult children who had a parent who had suffered for this for years. So they grew up in this kind of environment. Talk about growing up in an invalidating environment. And many of them at the end of the class, which really kind of surprised me, they basically realized the best way we can deal in the relationship with our parent right now, and the parents were like, the kids were like in their 30s, the parents were probably in their 60s, was to cut off the relationship with the parent. That was interesting. That happens with spouses. They get divorced. That's not the answer necessarily. Yet I think, and this is, again, one family member who's taught this class to a lot of different types of people, what I've observed. And I've observed that when you have a sibling, a parent, or a spouse, you have different kinds of choices than a parent. Because that little thing that you birthed and brought up is yours forever. And yet I also have parents in our classes who cut off their relationships with their own children for their own well-being, for their own self-validation or observing limits, and for the children, just to tamp things down. So you'll find these relationship vacations, as I talk about them. Sometimes mine was 4 days. Sometimes there was one gal in my class, she had a mother, and hers was a year, and then she re-engaged. She cut the mother off and she re-engaged with emails, and then it was coffees at Starbucks, and then she started slowly in baby steps reestablishing a relationship with her mother. That really gets down to, you know, if you're burned out, the reality is you can't help anybody. You know, you can't fill up somebody else's glass if your glass is empty. It's not even half full. Most of us are working with a half full glass. If it's empty, there's nothing left to give. So you've got to start getting yourself built up, putting your own oxygen mask on first before you can engage with another person who's in a difficult relationship. And that's why we encourage you to build some skills. Those are decisions everybody makes, but I can tell you for sure the dynamics of love are very, very different when it's a non-parent relationship.
I have a question about technology today. So with our
the wrong person there.
well, with cell phones and texting, and how do you set a limit on that? If they keep calling and they keep texting and you don't want to hang up, do you have any tips on how you might set a limit? And
you don't want to hang up? They keep calling? Well,
right.
we could do to them what they do to us, which is not respond. I don't know about you. When I send text to my niece, she's 33 now. She never responds to them unless she wants money or something or has a need for something. I don't understand, I guess, why you don't have the option of not responding. This is, you know, as relatives, we have the right to say no. No may be a non-response in the text messaging world. The one nice thing about text messaging, we talk about our emailing. I guess young people don't email anymore. I do, I'm old. But texting, it gives us a chance to really sit, and you've gone through this, Tina, you know, when you're texting one of your relatives, you can sit and really think long and hard about how you're going to say something, because how you express yourself is really important. Because it's important we keep the judgments out of it, that we are not teaching them a lesson and we're not showing our anger, that we keep ourselves regulated and deal with just the facts, ma'am, just the facts. And we can do that easier in a text message where we have some time to think and craft that message than if we're in the middle of a conversation and we're just reacting to a conversation. We try to get you to not react, but to act. And to act, you have to be able to step back and manage your emotions. And this class really is about emotion management. That's what it's really about. Us, not them. And if we can manage our emotions, then we can deal with the relationship more productively and more effectively. We can't when we're in an emotional state and we get sucked into all their texts and to all their conversations and all their accusations of blaming and excuses. And it's always our fault, right? And we're the one who's sick. So if we get sucked into that, it doesn't work. We've got to step back from the situation and detach a little bit. It's easier to do that on a text than it is in a face-to-face conversation, I would think. So I guess I don't even understand the question. If they're texting you nonstop, it's like my niece calling her parents nonstop. They just didn't answer the phone. That is an option, people. Now, easier for an aunt than a parent, and it is an option. It's hard for parents to learn to say no. I find that parents are the most difficult audience to learn to say no. You have that right to say no. It's one of the rights of relatives that we teach in the class.
So Susan, I want to thank you so much. I cannot wait for you to see these comments because they are all glowing, and
I want to get some feedback.
We'll get to see.
I'm going to be teaching this in 2 more classes.
So, and what I will say to everyone, we do have, I think, 35 open questions here that we did not get